As the weather starts getting cooler in Florida, it's that time of year again to start thinking about what we can do to combat the flu and stop the spread of this disease throughout our community. With us today from the Florida Department of Health in Polk County are Dr. Joy Jackson and Dr. Daniela Chiriboga. Ladies, thank you so much for coming out today.
Thank you. You're welcome.
So, first question, tell me a little bit about the flu. What is this disease that we are all so worried about?
Influenza is an illness that's caused by a virus, and it can cause symptoms that range from mild to severe, depending both on the person and the strain of the flu.
How exactly does the flu spread?
It spreads through droplets, so if someone is next to you and sneezes or coughs, you can breathe in those droplets, but also those droplets can land on certain surfaces that you would then touch and bring to your face.
How long can a sick person actually spread the flu to other people?
You're usually contagious from about 1 day before you develop symptoms to 5 to 7 days after, although some people can actually spread for a little bit longer, especially children and those who have sick immune systems. What this means is that you can spread the flu even before you know that you are sick.
That does sound kind of scary, actually. Speaking of scary, how severe of an illness is the flu? I mean, what's the worst that can happen to you if you get it?
Well, most people get mild symptoms. They'll get body pains, they'll get high fevers, but they'll recover on their own. Now, some young healthy adults, and especially those who are within the at-risk categories, which are those who are very young or very old, and those who have either chronic illnesses such as asthma or diabetes, or who have weak immune systems, and especially those who are pregnant, can get very serious illness that can lead to pneumonia and other complications and can lead to hospitalization and death.
Well, that definitely does not sound like a good thing. What can I do to protect myself against the flu?
What you can do to protect yourself is really using good hand washing techniques, avoiding touching community surfaces like doorknobs, telephones, handles of grocery carts, and then touching your face. So just being very conscious of again, touching your face after you've touched surfaces, avoiding those that are ill, and then very importantly is getting your flu shot. A vaccination is probably the most important thing that individuals can do to prevent themselves from catching the flu. A flu shot is effective about 10 to 14 days after the vaccination. So it's not effective immediately. So even though you've had the vaccination, you should still use good technique as far as preventing exposure to yourself. It's important for those that are at risk are most protected. So if you're a parent of a child under 6 months, which the guidelines are to give flu shots to those starting at the age of 6 months and up. And if you're a parent of a very young child, it's important that you get your flu shot to also protect your child.
Interesting, interesting. Now, I know that my mother would always tell me when I was younger, don't get a flu shot because it's going to give you the flu. And it never really seemed like it made a lot of sense to me. Is that actually true, or is that just a wives' tale?
That's actually not true. The flu vaccine is not a live vaccine except for the nasal form. Therefore, you can't get the flu from getting the vaccine. You may get a sore arm, you may even get a little bit of a fever, but you're not really going to get the full-fledged flu because it's not they're not injecting the live virus into you.
Interesting. Now, let's say that I've gone through all of the necessary things of washing my hands, not trying to touch different surfaces, and I've gotten a flu shot, yet I still end up getting the flu. What should I do if I get sick?
Not everything that occurs this time of year is the flu. You know, some rhinoviruses and other viruses can look like the flu, but they really aren't. Regardless, if you have relatively mild symptoms of a sore throat, a little achiness, use symptomatic relief. Advil, Tylenol, you know, your favorite painkiller, bed rest, and drinking plenty of fluids are the most important things. If you develop more serious complications, such as a high fever, headache, malaise that just doesn't go away, then it's time to, you know, obviously seek the advice of a healthcare professional.
Interesting. Now, what are the more serious emergency warning signs of people that have the flu that when you see these, it's like, okay, this isn't just bed rest, this is something more serious?
I think probably mental status change, a very young child that becomes lethargic or an older person that becomes lethargic, severe, GI distress, nausea or vomiting, anything that would say that your red flag says this person is really sicker than a garden variety flu, without a doubt go to a healthcare provider.
Excellent. Now, let's say that I do have the flu, but it's not as serious as that.
Mm-hmm.
How long should I stay home from work to try and get better?
At least a day after your fever is gone.
Now, what are some of the influenza vaccine options for 2013 and 2014?
There's a few options available. There's injectable forms of the vaccine as well as a nasal spray for those who are scared of needles. There's vaccines for children from the age of 6 months old to adults above 65 years old. And again, talk to your healthcare provider for them to recommend what the best form is. And don't let your fear of needles be a reason not to go, because there is a nasal spray available.
Well, for people like me that don't exactly have a stomach for needles, that is great news.
Now, you do have to be older than 2 years old and younger than 49 to get the nasal spray, and you have to have a healthy immune system.
Well, you've sold me on the fact that it's important to get either a flu shot or get the nasal spray. Where can one go to actually find these, though?
Fortunately, this year the flu shots are readily available. You can speak to your healthcare provider. Many physicians' offices offer them. The health department offers them at each of our sites. Many pharmacies offer them as well. So again, they are available. Not having a physician is not a reason not to get it, because again, they are readily available in the community.
Well, Dr. Jackson, Dr. Chiriboga, thank you so much for coming out today and telling us about all of this great information. And remember, as it gets cooler out, it's that time to start thinking about the flu and what we can do to combat the flu. Simple things such as washing your hands and making sure that you try to avoid people who have the flu are important, but also it's important to think about getting a flu shot. These can be found at, as they were saying, local pharmacies and places like that, but they can also be found at the Florida Department of Health in Polk County. And if you're interested in finding out more information about that organization and about how to get a flu shot from them, you can go to their website at www.mypolkhealth.org, or you can call them at area code 863-519-7900.